How can patients best be their own advocate? What about the patient going out and finding information, looking up clinical trials, for example, looking up the latest and greatest that they might find on the internet, realizing that not all sources on the internet are valid sources. But should they be looking up these things and coming to you and asking questions?
I usually encourage the patient to get more information. Different stages of your diagnosis and treatment, patients have different levels of anxiety. I think when you're first diagnosed with metastatic breast cancer and we tell the patient that it's not curable, it's really devastating news. And I think the first tendency is just to go out there and try to talk to everybody they can,
Right.
all the information that they can obtain. And that can be kind of confusing in the beginning, but as a healthcare provider, I think it's our role to help them to navigate it. And there are some very good sources on the internet, to help them to cope the situation, to learn and live better with their cancer diagnosis.
So how does a patient go about finding the right oncologist for themselves?
So usually a patient will be referred to a medical oncologist through the surgeon or their primary care physician who have a working relationship. Mm-hmm. So most of the time, the referring physicians will try to match the patient's personality with the physician's, style, mm-hmm. because we want everything to go well.
Right.
We want the best for our patients. Now, if you meet with your medical oncologist and having been diagnosed with metastatic breast cancer, you know that there is a long journey ahead of you. And if you feel that you are not having that trust and confidence in the medical oncologist, then, by all means, you should go for a second opinion. And I've had situations happen to me. I had patients go for a second opinion and then come back and say, I really like you, didn't realize, and vice versa. Some people, it's just different style. But fundamentally, we are here to serve our patients in their journey, to make their life easier and treatments more tolerable. So actually, I would ask you, how can we do our job better so that, you have in us an alliance, somebody that is really fighting the disease with you.
I think it's really important that the patient feel that they're part of a team with the doctor. I've had several oncologists and kept moving until I found the right one, and I now have one and have had one for 5 years that is absolutely wonderful, but it took me a while to find that individual. I think when you're faced with this illness, you realize that you're going to be with this doctor for the rest of your life and you're going to see them frequently. And your life in some respects depends upon their judgment, as well as obviously the effectiveness of the drugs, but the doctor has a big say in that. I think for the patient wants to be heard, and they want to feel comfortable with the doctor, and they want to feel that the doctor is really giving them the time that they need within reason to express themselves and get their questions answered. But the facility, I think, also makes a big difference. You want to be able to walk into a facility and feel very comfortable in the facility, and you want the staff to be friendly toward you, helpful, understanding, because you are going through a pretty devastating time in your life.